Everyone, today I'd like to talk about filler, specifically filler placement in the cheeks, and I'm going to use this mannequin to help me out. So why do we place filler in the cheeks? Well, it's in order to add volume to areas that have lost or lack volume, and everyone's different. Some individuals are born with less volume in their cheeks, others lose it as they get older. Now, how do you make it appear natural? So it's important to think about what youthful contours look like in order to avoid getting rid of those youthful contours. And the best way to think about what a youthful contour looks like is to think about what's called the Ogee curve. Now, an Ogee curve is something you see in individuals, especially youthful individuals, from a 2/3 view. It starts at the junction of the lower eyelids and the cheek. First, you see a convexity, or a bulging out of volume in the cheek. As you move down lower towards the center of the cheek, you get a concavity. And as you get older, that volume that sits up high starts to fall down and forward towards the lower part of the cheek. What effectively happens is you lose the convexity up top as well as the concavity down below. You get a flattening of that Ogee curve. Adding volume to the cheeks is helpful in individuals who have not seen significant volume droop as they age, but who lack volume or have lost volume over time. Now, what happens if you add too much volume to the cheeks? I think this is a major cause of filler fatigue. What happens is when you tend to add too much volume, you tend to add too much volume a little bit lower in the cheeks. And what that does is effectively flatten the Ogee curve as well, because you've kept the volume up high and added volume in an area where there should be a concavity. So you not only have a flattening of the Ogee curve, which can make people look older, but you also have an overall increase in the volume in areas that are unnatural. And so that's why someone can look a little older and a little uncanny when they've had too much filler placed in their face. From a front view, what you tend to see is a very thick, puffy, well-defined sort of peak of an upside-down triangle lower in the cheeks over the upper lip. So how do you avoid it? Number one, adding appropriate volume. And everyone's different. Everyone needs less or more depending on what they have, and it's important to be cognizant of that. And adding it in the right location. So avoiding placing it too low or too much volume too low, and focusing more in the areas where you want to restore or create some youthful contours higher up. Every person needs different amounts. I like to be conservative at first, and in some individuals I even space injections out over multiple sessions in order to maximize the chances that we reach their aesthetic ideal. Obviously you can dissolve filler if you dislike it, but I found that this approach tends to be very successful in getting what people want. So it's important to have a qualified injector who's thinking through these things and understands anatomy and how changing the anatomy with products like filler can make people look more youthful or actually less youthful and more unnatural.